afternoon, all. Today, topic is on fibrinolytics and antifibrinolytics. As you, we came to know about coagulation and its process, how coagulation happens, what is the purpose of coagulation in our body. This one is a natural fibrinolysis. This comes after coagulation. Whenever there is an injury in our body, that coagulation will happen in the endothelium, and this forms a clot. So if the clot lasts for a long time, then it might rupture and it might cause an embolism. So immediately after formation of clots, not immediately, after some time, that clot has to be eliminated from our body. So this is the process of fibrinolysis. This is a natural mechanism in our body. There will be fibrin, which is not fibrin. Sorry, this is a plasmin. Is the active fibrinolysin, which is present on every clot. So whenever this comes from plasminogen. This plasminogen is present on the endothelium. So whenever this plasminogen is not active, without fibrin, this plasminogen always present, but without any clot, this will be inactive. When it becomes active is when the clot is formed, this plasminogen will become active in the presence of tissue plasminogen activator. This tissue plasminogen activator is always released into blood through endothelium. So only in the presence of fibrin, this TPA will activate plasminogen and converts plasminogen to plasmin. This plasmin will form, will cut the fibrin, and this fibrin is like a mesh. Whenever this is like this is a clot which consists of platelets, WBC, RBC, and this when you think this is a clot, and this fibrin will be like a mesh. It will form like a mesh like this, so that no constituents will come outside. Whenever this plasmin got activated, this plasmin will cut the clot, like it will break the fibers, so that the material which is inside, that is platelets, they will come outside, and they will enter into the systemic circulation, and they will be excreted through urine or liver. And this is the natural mechanism. Like there will be natural inhibitors of plasminogen in blood. That is for plasminogen, alpha 2 plasmolysin is one of the inhibitor, and there will be inhibitors for TPA also. That is plasminogen activator inhibitor 1 and also 2. And like TPA, urokinase is also one of the activator of plasminogen. It is released from urine, and also other macrophages, monocytes, this urokinase is released. Like same like TPA, this urokinase is also involved in the fibrinolysis. But when compared to urokinase, TPA is more TPA is more effective, more potent when compared to urokinase. So I'll tell the this clot formation, whenever this fibrin is formed, this fibrin, if it is more fragile, there will be more possibility of bleeding. So when it is more intact, that fibrin clot is more intact, formation of thrombus is more. Like in disorders like bleeding disorders like hemophilia, this there will be clot formation is very less, and also more bleeding will be there. So these fibrinolytics are contraindicated in hemophilia patients. And one more thing. These these clot formation, this fibrin formation also depends on calcium concentration, pH, pH of blood, and also platelet number of platelets. Obviously, if their platelets are less, there will be less clot formation. And also, if there will be isomers of this fibrin, not fibrin. These TPA will have two isomers. One is alpha gamma A, gamma 1 isomer, and one more is gamma A, gamma A. This is one isomer, and this TPA has two isomers. This gamma A, gamma is active isomer. It is more potent, and gamma A, this one is less present, and this is less potent, because this gamma A, gamma 1 will have thin fibrins, the thin fibers, so that the nature of fibers is also important to form a clot. And this one will have thin fibers, so that it will form like a strong clot. And when it comes to regulation of fibrinolysis, this plasminogen activator inhibitor 1 and inhibitor 2, and one more is there. It is alpha 2 antiplasmin. This one will inhibit plasminogen. These three will inhibit the fibrinolysis process. And now comes to fibrinolytics. The classification is first generation and second generation. First generation is streptokinase, urokinase, and the second generation is RTPase, dutyplase, retyplase, and also one tenecteplase. And when it comes to streptokinase is extracted from beta hemolytic streptococci, and this mechanism is this streptokinase will bind to plasminogen. It is like a scissor. Here there will be lysine binding site, and this will be the catalytic site. This lysine binding site will bind to the fiber present like a fibrin fiber to the lysine binding site, and this catalytic site will cut the fiber, so that the fibers will cut down, and thus this fibrinolysis will happen. And one more thing, this streptokinase not only cut the fibrin present in the clot, it also cut the fibrin present in the circulation. So what happens is, in that usually this this alpha alpha plasmin, and when you think this is a plasminogen, this is alpha plasmin present in the blood. So this will bind to this is lysine binding site. This alpha 2 plasmin will bind to, usually the normal mechanism is this will bind to lysine binding site, and this catalytic site will sit here, and so it blocks the action of plasminogen. This is a normal mechanism. When it comes to streptokinase, when streptokinase binds to this plasminogen, so this will activate more release of plasminogen into blood. So whatever these alpha 2 antiplasmins are present, they will bind to this plasminogen. Then there will be more leftover of this plasminogen. So this is the cause of bleeding in when you take streptokinase. And when it comes to the uses of streptokinase, it is used in myocardial infarction. Within 1 hour you have to give. Acute ischemic stroke, peripheral arterial thromboembolism, DVT, to restore catheter and stent. And when adverse effects are as usual allergic reactions. Allergic reactions are because these as streptokinase is extracted from beta hemolytic streptococci, there is a possibility of formation of antigens in our body. So these antigens will cause the formation of antibodies in our body. So reaction of antigen antibody reaction will give allergy, but this allergy is not that significant. So you can ignore that one.